Stress. It affects relationships. It causes illness. It hurts careers. On this edition of Meeting the Challenge, find out how stress is affecting you. Is type A behavior hurting your health? We'll talk to the doctor who wrote the book on the subject. And we'll learn some stress-beating diet and exercise techniques that fit into even your busy schedule. Bumped from your flight, our financial expert and radio guru, Bruce Williams, tells you how to pick up the pieces.
I would say work is the most stressful. Usually it's because you're working a lot of hours when there's a lot of stress, and then it kind of wears you down.
Trying to manage work, school, raising children.
Being around stressful people. That really stresses me out.
You don't sleep well, just like you said, you don't eat well, and it just takes a toll on your body.
Hello everyone, I'm Teresa Richardson and welcome to Meeting the Challenge. In this edition, we'll be taking a look at what we can do to reclaim our lives from stress. Doctors report that 80% of their patients suffer from stress-related symptoms, ranging from colds and migraines to depression, high blood pressure, and heart attacks.
No one can get a heart attack under 60 unless he is type A. I don't care what he eats or what he doesn't eat.
Since the 1950s, Dr. Meyer Friedman has been studying the connection between behavior and cardiac disease. In his 1974 bestseller, he categorized certain behaviors as type A. His discoveries rocked the medical community. He said that how we handle stress emotionally can mean the difference between life or death.
Type A behavior is a behavioral disorder characterized on the outside by impatience or a sense of time urgency, and usually accompanied by free-floating hostility, free-floating that you get irritated by small things, that you're actually looking to get irritated. We look at a face, is it hostile? Or we listen to the voice, is it rapid? If people finish other people's sentences before they allow the person to finish the sentence, that's impatience. It's impolite too. We are interested in certain eye signs. Browning around the eye. 25% of severe type A behavior has tanning around the eye, brown. The pituitary putting out the hormone ACTH, which causes that browning. It's due to stress. Trying to do too many things in too little time.
This waiting room chair offered an early clue about type A behavior. The upholstery wore out only at the front of the seat and arms from patients impatiently straining forward.
The upholsterer came in and said, "What kind of practice you have here?" Because our patients would come in, "What is the doctor going to say to me? I'm parked my car. The meter is going out. Always, can I use your phone? I want to make the phone call." They're always insecure about it and impatient. These people with coronary disease.
Well,
Newsman Doug McKnight knows the dangerous effects of stress firsthand. He suffered a serious heart attack the week after coordinating the news coverage of the 1991 Oakland fires.
I had it on a Sunday morning, exactly 1 week after the Oakland fire. It hurts. It's a very strong pressure on your heart. At the time, I was doing exercise. I was exercising a great deal. And I actually had it while I was lifting weights. And I went home and said to my wife, I don't feel real good because you feel a little nauseous. And she said, well, maybe I go to the hospital. And, no, I don't want. I just got to get something to eat. And then it just really started hurting. And then your arms start to tingle because what's happening is the blood is cut off to the heart itself, and the heart starts to die, so it can't pump anymore. And so at that time, I figured going to the hospital probably was a prudent thing to do.
It's essential that stressed out type A's permanently change their ways if they want to avoid further illness.
The changes that I went through after the heart attack were really more dietary and then philosophical. I mean, before the heart attack, I took life for granted. I mean, I got up every day and did the thing. After that, I realized that every day is a gift, and that you have to make this day special, and that you have to make this day count for something. And it's not a pressure thing. It's really taking time to enjoy that day. Find something good every day to enjoy, because you don't know how many days you have.
They wanted a quick pill. It's like an exercise program. These exercise organizations flourish for about 4 or 5 months, and most of the type A's drop out because they don't have time to exercise. And our patients didn't have time to meditate or go through progressive muscular relaxation. For those who go through the program, their wives notice the change, or their husbands notice the change in their wives. Their children notice it. They become human beings again.
The results of type A behavior modification are also documented medically. In a 4-year study of 1,000 at-risk patients who had already suffered a coronary, the 500 who received behavior modification experienced a 50% reduction in deaths or second heart attacks. The control group was then given the same behavior modification. Within 1 year, there was a significant reduction for that group as well.
And group therapy is very important. The group, because sometimes the only time a man has friends, they tell us, is from the groups themselves. They can open up and discuss. And then they find out that the first thing the type A person who was doubtful that he had type A was he noticed the other people in the group were obviously type A. It's so easy to see type A in other people. Then he begins to see, hey, I'm type A too.
In addition to group therapy, the Meyer-Friedman Institute is currently testing a video program for type A behavior modification. We'll give you a number to call at the end of the program. But first, a question. Fact or fiction? Can there be such a thing as positive stress? We'll be back with the answer in just a few minutes.
Knowledge TV Retro, brought to you by Jones International University, the first fully online accredited university. Change your life for the better on your schedule. 8-week classes begin next month. Visit jiu.edu to find out more.
Fact or fiction? Can stress be positive? That would be fiction. Researchers say that emotional stress has the same effect on our bodies whether preparing for a wedding or suffering from a divorce. Fitness and nutrition expert Steve Sokol teaches people how to manage stress naturally in high-pressure Silicon Valley.
Well, the solution is not so much to eliminate stress. You can't. You're still going to be bombarded by daily stressors. Again, maybe you will have to drive in traffic. Maybe your job is a relatively higher pressure job, but there are ways to manage your stress. Some of the ways that we can help to manage our stress would include being in better physical condition. My exercise prescription for someone under a lot of stress would be a balanced fitness program, one that would entail an aerobic or cardiovascular component, such as walking, riding a bike, swimming, doing an aerobics class, which will raise your heart rate and make your heart stronger. Your heart is a muscle. And as we're increasing our heart rate, we're learning how to burn fat, and we're also getting rid of the stress hormones that are in our system. When we're under stress in this fight or flight mechanism, our adrenal gland puts out stress hormones which then need to be utilized, or they can be damaging to the body. So during aerobic exercise, we actually burn off those excess hormones that are floating around our bloodstream, and also make our heart and lungs stronger, get rid of body fat, teach our body how to burn fat. And then also release endorphins, which are very powerful chemicals which give us this feeling of well-being. And as actually exercise, particularly aerobic exercise, is used as part of a recommendation for dealing with depression to help you feel better. Another aspect is actually making your body stronger through doing strength training exercises. The more muscle we have on our body, and the more confident we are in our strength level, that self-esteem will go up, our confidence will be enhanced, we'll feel better about ourselves, which in turn will help us to deal with stress better. Because simply being overweight in itself, aside from being a physical stress, is also a mental stress. We're not as happy with ourselves as we could be. And then finally, the last part of our package, if we look at aerobic exercise, we look at strength training, part 3 is stretching or flexibility exercise. And that, in its extreme form in dealing with stress, might be called yoga, where you have a mind-body connection and you're dealing with relaxing and de-stressing muscles, and then also incorporating breathing and visualization exercises at the same time. Through all of our exercise, we want to learn how to do deep breathing exercises, which again will help to lower heart rate, lower blood pressure, and help us on a daily and minute-by-minute basis to manage our stress levels. If you devote 4 45-minute sessions to yourself, and this is the minimum level, this is not necessarily optimum, you will end up, by spending that time, save time, because it's going to lower your anxiety levels, it's going to allow you to think more clearly, it's going to give you more physical endurance. So instead of going home at the end of the day from work and being tired and laying down on the couch, you'll be more able to get up and do chores after you've exercised. You'll actually gain more energy, gain more endurance, and save time. When you go into those convenience stores, it's just as easy to go get the healthier foods as to go grab that Snickers bar. And if you remember that Snickers bar commercial, it says, have a Snickers in the afternoon. Well, if you ever tried it, what you may have found is your blood sugar and energy went way up, and then all of a sudden you crashed back down because your blood sugar goes up, your pancreas releases insulin, which gobbles up all that extra blood sugar, and it crashes you back down again.
One common stress-related illness is high blood pressure, or hypertension, which affects 1 out of every 4 Americans aged 16 and older. When the heart pumps blood at a force greater than necessary, such as in times of stress, blood pressure rises. When it becomes too high, the entire circulatory system strains to continue functioning. This condition, hypertension, is known as the silent killer because it usually has no symptoms. Have your blood pressure checked by a medical professional. If it's too high, your doctor will help you design a program to bring it under control. The most important thing you can do is maintain a normal weight through healthy eating and exercise. If you require medication, be sure you continue taking it even if you feel fine. You can also monitor your blood pressure regularly at home. Home monitors are inexpensive and very reliable when used properly. We'll show you how when we return. Home monitoring doesn't replace the advice or care of your own physician, but it helps you and your doctor keep track of any changes. It also eliminates the possibility of white coat hypertension, higher blood pressure due to the stress of being in the doctor's office. First, you need the right equipment. Your doctor or pharmacist can help you select the right model for your needs. Finger monitors, for example, aren't appropriate for people who have abnormal blood pressure. Also, cuffs come in different sizes, so be sure the one you buy fits your arm measurement. Now, for an accurate reading, remember these 4 things. Number 1, environment. Take your blood pressure at the same time each day in a quiet room with no distractions. 2, body position. Sit with both feet on the floor. Your arm should be level with your heart and fully supported on a table. If you roll up a sleeve, be sure it's not tight, constricting the flow of blood. 3, cuff position. Place the cuff on your bare arm an inch above your elbow over the brachial artery. It should be snug but not tight, and you should be able to fit 1 or 2 fingers between your arm and the cuff. Number 4, technique. Carefully follow the directions for inflation that come with your unit. You'll need to inflate the cuff to 30 millimeters of mercury over your usual systolic reading before allowing it to deflate. Sit still during the reading and don't talk. Talking can increase your blood pressure by as much as 15 millimeters of mercury. And finally, record your reading and wait at least 10 minutes before taking your blood pressure again. If you'd like more information on hypertension, we'll be giving some websites and phone numbers at the end of the program. When we come back, we'll show you a simple workout that keeps you limber and energized without ever leaving your desk.
One of the primary areas that people carry stress is through the neck and the upper back. And very often, people with neck pain, neck problems, usually have it on one side. Now let's figure out why that is. Usually, a busy person is doing 2 things at once, maybe talking on the telephone and writing simultaneously. Well, by bringing that trapezius muscle into flexion on only one side over and over, and then having the neck crunch down on it, you make that side tighter than the opposite side. So what I like to do is teach people how to stretch the muscles of the neck. So what you do is drop that shoulder down, put your hand across your head, and simply stretch very gently across, and that will help limber up those muscles. Other people carry stress in their neck and upper back because they've raised their shoulders up and they're real tense. So what I like to do is have them flex their trapezius muscles, again, bringing their shoulders up right by their ears to feel what that full contraction feels like, and then drop them down so that you feel what full relaxation is. Because a big reason why we carry stress and feel that fatigue in our upper back and neck is because we end up like this. Our shoulders are halfway up and we don't realize it. By coming up all the way and then coming down all the way, then we understand how to fully relax our muscles. Another great de-stressor for the upper back is giving yourself a big hug, because we all need hugs, and who better to do it than to ourselves? So you just reach around, you grab your shoulder blades, and you stretch out that upper back, and it feels great. And then another thing you can do is just do that one arm at a time to focus more on first the left and then the right shoulder blade. So we simply pull across this way and stretch that out and feel that across that upper shoulder blade and upper back, and then come across the other way and do the same thing. Another great exercise that we can do is stretching out our back. Many of us, when we're sitting down, we slouch. We round our shoulders forward. That puts a lot of stress on breathing. It makes breathing more difficult to do. And when we can't breathe easily, gets us in a bad mood. We don't think as clearly because the oxygen's not coming to our brain. So we want to sit up tall. We want to open our chest up, and we want to allow that breathing to occur very easily. We can also just bring our shoulders back at that same time and get a nice stretch through the chest. To maybe enhance that even further, we reach around, clasp our hands, and just, again, reach that chest up. So these are all ways to uncoil and de-stress the upper body. Get up from the chair every hour, even if it's just to take a few paces back and forth, and try to stretch out at least every hour or two. Now, that doesn't mean going through your whole body. It doesn't mean taking a lot of time. It simply means maybe standing up, spending 30 seconds or a minute out of your chair. And I really don't think any employer or any boss in the world is going to get on your back about taking a 30-second to 1-minute break on an hourly basis. And it will definitely make you more productive. So I would urge all the employers and bosses out there to encourage people to do it. Earlier, we spoke about what I do at some of the corporate sites. Well, at some of our corporate sites, we've actually gone in and taught stretching programs that are now administered by the different department heads to be done on a twice daily basis as a break throughout the day. And it has been shown over and over that as you stretch out, as you're more comfortable, your physical stress levels will drop, and with your physical stress levels, you'll feel more comfortable, you'll feel better. Emotional stress and mental stress will also decrease at the same time.
One thing that raises anybody's blood pressure is being bumped from a flight. Here's our expert, Bruce Williams, with the right way to get some satisfaction.
Sooner or later, you are going to get upset. It could be because you were turned down for boarding an airplane. Well, holding your breath, turning purple, kicking your stamping is not going to help very much. Tell him you're going to see him in court, that you'll never fly with this airline again, that you're going to tell all your friends doesn't get you very far. Well, what will help when you're complaining? First of all, be rational and reasonable. If a flight is held up because of weather or mechanicals, those things happen. You know what I think, and I fly a lot, time to spare, go by air. Simple as that. But if you're going to complain, do it properly. Do it in writing, do it quickly, and also do it briefly. You send a 17-page letter to the CEO, I will guarantee you how quick that's going to go into the shredder. If you can get it down to 2 or 3 paragraphs, making your point quickly, and on decent stationery, and try not to write in crayon, that doesn't impress too many people, that's the way to get some action for yourself. And that's true of any kind of a complaint. Most businesses, at least at the upper levels, do not want unhappy customers. On the other hand, the last thing they need is letters saying threatening things. We'll never shop there again. We're going to organize a boycott, because the reality is you're not going to do that, and they know better. If their airline only goes to the city where you're going to go anyway. But most companies want to keep you happy as a customer. When you're right, be succinct, be polite, and be firm. You'll be surprised how far that will take you. Works for me. I'm Bruce Williams.
Whether bumped at the airport, commuting in traffic, caring for a sick child, or anything else that creates stress in your life, be sure you make time to take care of yourself. We want to thank you for joining us. I'm Teresa Richardson. We'll see you next time.
Knowledge TV Retro, brought to you by Jones International University, the first fully online accredited university. Change your life for the better on your schedule. 8-week classes begin next month. Visit jiu.edu to find out more.
Tells you how to pick up the pieces.
I would say work is the most stressful. Usually it's because you're working a lot of hours when there's a lot of stress, and then it kind of wears you down.
Trying to manage work, school, raising children.
Being around stressful people, that really stresses me out.
You don't sleep well, just like you said, you don't eat well.
Stress. It affects relationships. It causes illness. It hurts careers. On this edition of Meeting the Challenge, find out how stress is affecting you. Is type A behavior hurting your health? We'll talk to the doctor who wrote the book on the subject. And we'll learn some stress-beating diet and exercise techniques that fit into even your busy schedule. Bumped from your flight, our financial expert and radio guru, Bruce Williams.
Behavior is a behavioral disorder characterized on the outside by impatience or a sense of time urgency, and usually accompanied by free-floating hostility, free-floating that you get irritated by small things, that you're actually looking to get irritated. We look at a face. Is it hostile? Obey. I don't care what he eats or what he doesn't eat.
Since the 1950s, Dr. Meyer Friedman has been studying the connection between behavior and cardiac disease. In his 1974 bestseller, he categorized certain behaviors as type A. His discoveries rocked the medical community. He said that how we handle stress emotionally can mean the difference between life or death.
Type A.
And it just takes a toll on your body.
Hello everyone, I'm Teresa Richardson and welcome to Meeting the Challenge. In this edition, we'll be taking a look at what we can do to reclaim our lives from stress. Doctors report that 80% of their patients suffer from stress-related symptoms, ranging from colds and migraines to depression, high blood pressure, and heart attacks.
No one can get a heart attack under 60 unless he is type